The following portion of Studio 512 is sponsored by Texas Colon and Rectal Specialists. March is Colon Cancer Awareness Month. Colorectal cancer has become the leading cause of cancer-related deaths among Americans under 50. We're joined by Dr. Lakshman from Texas Colon and Rectal Specialists, a specialty division within Texas Oncology, to unpack what's behind this alarming rise and how early screenings can save lives. It's really important information today. So Dr. Lakshman, we've been hearing about that rise in colorectal cancer among younger adults. Why is this trend so concerning?
Yeah, it is very concerning. Thank you for having me, Rosie. We're not really sure is the short answer. Why this has become really prominent, we're seeing a lot of this in the news, is that a big study just came out. This past month was published in JAMA, the Journal of the American Medical Association, and it was looking specifically at cancer deaths in this population of people under the age of 50. And so the researchers looked at cancer deaths here in the United States from the time frame of 1990 to 2023. Overall, cancer deaths, the rate of cancer deaths decreased by 44% in that population of people under the age of 50, except for one, which was colorectal cancer.
Wow. Okay. What are some symptoms that maybe younger adults should be aware of to say, aha, okay, maybe it's time to go in for an early screening?
Sure. The first, most important thing to look for is if you're having rectal bleeding or blood in your stools, right? Particularly in the younger population, really for anyone, seeing, bleeding or blood in your bowel movements is a warning sign for sure. Something that you shouldn't just dismiss. You should keep an eye on it and talk to your doctor about that as well.
Okay, so what's the traditional age of screening now, and who should get screened even earlier than that?
Yes, good question. So the age for screening, according to the American Cancer Society, our U.S. Preventative Task Force, is now 45.
Wow.
It used to be 50, but now for average risk patients, it's 45 years of age for your first colonoscopy. If you have a family history of colon cancer, you have a personal history of some other contributing diseases like inflammatory bowel disease or perhaps some maybe genetic predisposition, then it'll be earlier ages depending on some of those other factors.
What is your top tip for viewers who are watching today, especially for that population under 50?
For sure. Listen to your body, pay attention to the symptoms. I think if you notice a consistent change in your bowel habits or blood in your stools, talk to your doctor, or even some of these other things like you mentioned about, maybe you feel like it's just an upset stomach or you're having some digestive issues. If it's persistent and it's really out of the norm for you, you need to talk to your doctor.
Really important advice today. Dr. Lakshman, thank you.
Thank you.
For more information or to request an appointment, visit tcrscolondoctors.com or call the number on your screen. The preceding portion of Studio 512 was sponsored by Texas Colon and Rectal Specialists.